is Sarah Jenkins. I wanted to take a couple minutes today to describe another video that I wanted to put out on the internet about equine therapy. The previous one that I had is about equine-assisted EMDR, and this one is actually about, for those who are equine therapists out in the field and people who are working with folks and doing equine therapy, I think it's really important that we are really cognizant of what happens with our clients in terms of their trauma histories. So I've actually been a trauma therapist for about 10 years. I speak and do a lot of conferences on trauma and trauma recovery, and also I'm an EMDR consultant. So I really think it's really important for folks who are doing equine therapy to have a key understanding of what it means for clients who are coming in with a trauma history. So because of that, I wanted to give people a couple of things to think about when they're working with trauma survivors. First of all, we know, many people talk about that with equine therapy, folks are going to actually be, in a lot of cases, projecting their experiences on their horse experience. You know, they're going to actually possibly have these projections in terms of how they interpret what happens with the horses. One of the things that as an EMDR therapist that I think is really important is that we also think about, excuse me, that trauma survivors actually, because they have memories that are stored in a very unique way, they're stored in a way that actually is in a place in the brain that is very reactive versus responsive. If you're working with trauma clients in the arena, you may actually find that their neural networks are actually becoming activated in the arena. So it's not only projection, while it's a key part of it, that their neurobiology is actually getting activated. And because of that, what happens is that when they are experiencing that horse becomes something from their past, but it becomes that thing from their past on a biological level. So their amygdala, that part of their brain that responds to danger, starts reacting to that just as they would in the history of that trauma. So as an equine therapist, it's really important that you understand the neurobiology of trauma. If you don't, certainly contact me. I can give you more information on that, and I can give you some resources and tips and tricks for that. But make sure that you understand the neurobiology of trauma. Another thing to know as an equine therapist is also what it means for a client to be dissociated. So if you have someone that has a history of trauma, dissociation and trauma go hand in hand. So trauma is something that if you actually start to feel the trauma and your system starts to believe, hey, if your trauma is so much that your system is unable to tolerate it, you actually dissociate in order to cope with it. So what this means is that that pain is so difficult that I can't stand it, that my emotional system knows how to shut down, block it out, keep me numb, keep me disconnected, keep me out of my body, etc., in order for me to stay away from that trauma. And if you're working with clients out in the arena, you will see them dissociate in response to perhaps an experience they're having with one or more of your horses. They may check out, they may numb out, they may actually, excuse me, act as if or suddenly present as if they're really younger, sometimes even older. They may actually freeze, they might actually run, or they may actually get a fight energy that kicks in because that fight, flight, or freeze response has started to kick in. So when people are dissociated, it really means that they're so traumatized that their system thinks that it has to kick in and block the emotion from coming. And of course we know that these amazing creatures, over there, that these amazing creatures have this ability to really connect us to our emotional selves. And if your clients haven't been feeling or been able to access their feelings, and then suddenly that horse helps them access it, they might start to dissociate a lot more because it might be too much for them to tolerate. So the third thing you need to know relates to this concept of dissociation. You need to know grounding skills. I have some information on my website available on grounding skills. I also have a YouTube video available on that as well. I'm going to give you 3 right now. If you're actually out in the arena and your client starts to dissociate, the first thing you want to be able to do is get their left brain activated. If they're traumatized, their right brain is getting activated. It's kind of like horses out in the wild. They're actually looking for safety, and of course humans we are as well, especially if we're traumatized. And for a human, the tendency is to immediately get in that right brain place because of fear. So we have to get the left brain activated. That means getting them into a logical kind of place. So start asking your client simple things like what their phone number is. Maybe have them start to actually number the rails on the fence, or actually count how many horses are in the stalls, or actually get them to actually count how many objects they see in the arena. It could be anything. So you want their left brain to get activated. Another grounding tip you can use is to actually start getting them to put their feet in the ground. So for example, if you're in an arena like this with this kind of sand, get them to actually feel what it's like for their foot to be in the sand. to hear the sound of the sand as it's touching their feet, even to reach down and actually touch it to help them get grounded. So that's 2 of the tips you can use. Another thing is actually smells, and of course all of we horse lovers know that horses have all sorts of smells associated with them, good, bad, and otherwise. But actually getting the client to maybe touch the horse and then smell the horse, to actually be able to feel what it's like to touch the horse's mane, to touch what it's like to feel his coat. It actually gets the sensory experience and to help the person get more grounded. So those are 3 things that you can take away. If you want more information about being a really trauma-informed equine therapist, you can visit my website, dragonflyinternationaltherapy.com. Also visit eaemdr.com, which is more information on my protocol for equine-assisted EMDR. And I really appreciate you taking the time to listen to this video. Take care.